South Africa's biggest medical scheme administrator, that's Discovery Health, is prepared to move members around the country to make room for COVID-19 patients should the need arise. The development comes as concerns mount over the spreading coronavirus and worries that even private hospitals will be forced to turn patients away. At a COVID-19 Command Council briefing last week, Gauteng Health MEC Dr. Bandile Masuku said his department expected a shortage of at least 800 beds by the end of this month. Gauteng, as you know, is now the epicenter of the outbreak with more than 87,000 cases. A further rise in cases could mean more state sector patients in private hospitals. Let's bring in now, the CEO of Discovery Health, that's Dr. Ryan Noach, to help us understand what the plans are. Dr. Noach, thanks very much for your time and welcome to the AM report. Let's start there with a point of clarity. What exactly is Discovery Health offering?
Morning, and thanks very much for having me on your show. Quite simply, we're in daily contact with all of the private hospital groups to understand exactly what the available bed capacity is in the hospitals across the country. Most of the pressure that you're referring to is actually on the critical care beds, which are the high care and ICU type beds. I'm pleased to tell you that across the country today, every single patient that's needed intensive care in the private sector has received that. And I think the public sector has similarly managed to cope extremely well. This is really something we should all appreciate as South Africans. You know, we've seen some very well-developed healthcare economies, some of the best healthcare systems in the world, in Milan in Italy and in New York City in the USA, which were totally overwhelmed by the COVID-19 epidemic. And in South Africa, notwithstanding us looking like the Western Cape has faced the worst of it, and potentially even Gauteng already faced the worst of it, our healthcare system seems to be coping well. In the unlikely eventuality that we do find that there are no ICU beds left in a particular area, what we've arranged with the private hospitals to try and help them and support them with capacity during this period is that we will transfer some of our members who are occupying ICU beds, potentially and hopefully the non-COVID-19 members. So we will take non-COVID-19 members receiving care in ICU, and we will move them to other parts of the country where there are available ICU beds. And in doing this, we will create capacity in the ICUs to ensure that every single patient arriving at hospital who needs an ICU bed is able to get one. I guess we're fortunate as a country in that different parts of the country are peaking in the COVID-19 outbreak at different times. And that does mean that there is capacity around the country at any one time.
Right. The real prospect, though, is that any given, member that's affected by this could be moved multiple times, depending on where the peak approaches next. How are you planning to approach that complexity?
No, that doesn't seem like a possibility at all, and I don't agree with you that that's likely at all. At the moment, we haven't needed to move a single member, and actually the system has coped exceedingly well, and we should be very proud as a country. In the event that we do move members, we would be definitive in moving members to an area where there is really sufficient capacity, and understanding then that it would be a single move. And we would be moving to a region that's not under ICU pressure. For example, a very good example of that is that at the moment, the private hospitals in the Western Cape have really emptied out. It seems very clear that this first peak, this first wave of the epidemic in the Western Cape has settled. We're all hoping, of course, that there is no second peak. But this has resulted in the hospitals in the Western Cape being quite, under no pressure at all at the moment. In fact, their occupancies are below 40% from what we're told by the hospital groups. And so if needed, if, for example, the Eastern Cape was under pressure, we could easily move patients now to the Western Cape where there is really ample capacity.
It's interesting, though, that this only affects Discovery Health members. What do you say to critics who suggest that the perception that this is altruistic is not necessarily accurate? Why not, offer your services for everyone in the country who is willing and can be moved to do so for the greater good of the country, so to speak?
It's clearly not our mandate at Discovery Health Medical Scheme The medical scheme's primary obligation, of course, is to its members. As I think you understand, the medical scheme is a not-for-profit fund, a mutual trust fund of members' money. It has contracts with the hospitals, and the obligation is, of course, to ensure that the members receive optimal care and that it's funded as per the members' benefits. At a social level, at Discovery Health, we're doing everything we can to support the country. Our recognition was that actually the greatest need for the country was to improve access to primary health care. And so one of the social initiatives we've undertaken is that we've offered free primary health care consultations with general practitioners to any South African across our virtual consultation platform, Dr. Connect. So we are connecting South Africans who may have the need for a general practitioner consult with GPs across the country for free in a partnership with Vodacom. While it's free to the member, Vodacom and Discovery are paying the doctors for those consultations.
Yeah, but Dr. Noach, you and I both know that in any instance, even without a pandemic, most of the time the people most in need of assistance are not necessarily in private care. And given that, perhaps let me ask it this way, if the contractual concerns weren't an issue, would Discovery Health be open to the prospect of helping everyone across the board and not necessarily just members?
No, it's not our obligation in the system. And while we are a force for social good, obviously we have a finite capacity, responsibility and capability. And Discovery Health Medical Scheme, which looks after about 7% of the South African population, has its primary obligation to Discovery Health Medical Scheme members.
All right, let's leave it there. Thank you very much for your time. Certainly appreciate your getting us into the loop insofar as that is concerned. Dr. Ryan Noach is CEO of Discovery Health. Discovery Health, they're stepping in to say that they're willing to move around only their members if there is a need for ICU beds. I wonder what you make of that prospect, insisting that it's not part of their mandate to, I guess, extend that to everyone across the country.